My name is Darius. I was just diagnosed with pancreatic and liver cancer and pretty much everywhere internally by now, stage 4, yesterday. And, obviously this has been going on for a while. I always get my physicals. I get extensive physicals. I asked for them. And at 49 years old, my physicals come back as if I was 25. My blood pressure is normal. My cholesterol keeps lowering every year to the point that my doctor was surprised. Everything always showed perfect. I don't eat vegetables because I don't care for them. But my diet is pretty decent. I don't drink Coke I don't drink any caffeine, the only toxin in my body would have been alcohol. But even that probably wouldn't cause this. Anyway, so,
Physically, how do you feel right now?
discomfort, a lot of discomfort of the abdomen, yes, very distended, and that makes it very uncomfortable unless I get the medication. And then that extends apparently, and it would have been one of the symptoms that would have detected it. Puts pressure on the spine, so I get pains like shoulders and legs, and wherever it touches a nerve, I feel pain there, but I have no injuries or any other reason for there to be pain in those places.
How did you first start to feel sick?
About 2 weeks ago, I started feeling some abdominal discomfort or pain, like if it was bloated. And then it was very uncomfortable. Mostly, I try to sleep, since all of a sudden I looked like I was 9 months pregnant, and I'm not with abs in good shape now, but I didn't have that kind of belly. So I would lay to the left side, it was uncomfortable. The right side was really uncomfortable and painful. And on my back, it was almost just as uncomfortable. And it started distending to the point that I thought I would get a hernia or something, because it was pushing out on the abdominal muscles to the point that it was very painful. Yesterday, when they extracted the 3 liters of fluids from my abdomen, as they were taking them out, and it was a lot of relief, the muscles have been stretched so much that they felt as if I was doing like a workout of ab workout.
How did they take out that fluid?
They used the ultrasound, and they find, I guess, the best place, and it's maybe 1 millimeter incision where they put a needle and then just suck it out with the suction slowly.
Were you awake for that?
Yeah, it's local anesthesia that they put. And they took a biopsy of my, what is it? I forgot the name of it, but it's the lining of where the intestines are. So that's what tells them.
The omentum?
Yes, omentum. That's what tells them, if that's positive, that I have cancer. I used to get on my physicals every year. I'm a stickler for that. I take advantage of whatever the insurance pays, all the physicals, and everything was always fine. And for my age, I'm fine. So I'm not exposed to, I would say over the past 5 years, exposed to a lot of scans and things like that from injuries or dental work, but I doubt that radiation was the cause of this. But, so all of a sudden, yes, we remember, my daughter and I, that last year I had this pain. You gotta trust, if you know your body. One of the things, and I've done this since before I was a medic, always my whole life. When you go to the bathroom, turn around and look. The consistency, the color, everything. People just flush. I always looked at, just to know how I'm doing. So I used to do that, and then a couple of years ago, I never suffered from diarrhea, but all of a sudden I was getting this like 4, 5, 6 days, and I knew my body wasn't feeling right. So I said, let me go to the doctors, and since I know what words to say that would provoke a certain test, because if you don't, doctors don't send you because insurance won't pay. So I used those words, and I went to the one doctor, and he says, do you want a colonoscopy? I said, yes. And that's what I wanted for my age. They only do it after 50, but I knew what to say, so I had it, and all he found was some hemorrhoids, but everything was fine. But I knew something wasn't right with my body. So that went away. A little while later, my daughter now reminds me, all of a sudden one day I thought it wasn't a pull muscle. I had this one pain on my left quadrant, upper quadrant in the back. And it wasn't kidney, but this thing was like 7 to 10 days like I thought I was gonna die. It reflected everywhere. Again, it went away. I didn't go to the doctors for that, and I should have.
How do you feel emotionally?
Emotionally, well, it sucks to be dying. It would have sucked more to just die really fast. I always thought I was going to die either in an airplane crash or a motorcycle accident. I don't think I'm going to be able to ride the motorcycle anymore. But it does open up a whole new realm of jokes, which I couldn't do before, about cancer and people dying. So I joke about everything, and that was the only one left that I couldn't joke about, and now it's open to me. And people around me don't want me joking about being dead. The thing is, I could do anything. I don't have to eat healthy. I could start smoking if it wasn't that smoking stinks. Maybe cigars. I could go back to drinking. And I just need to know more or less what the time frame is going to be so I could plan. I'm planning a party, my memorial party, because if anyone's going to go to my funeral, it's going to be me. Yeah. It's not that it hasn't hit me, it's just, what am I going to do? Cry about it?
Yeah, but you do have a daughter, right?
Well, she's not dying. Let her do the crying.
What do you think about that? Can you talk about that?
She's 26 and married, and she turned out better than I would have been if I was a woman. So it's going to be hard for her, but she can deal with it. She's not a little kid, so I'm not leaving her orphan. I would have liked for her to give me a grandchild. I don't think I'm going to make it 9 months. If there's a positive side to dying, is that my cousin won't be my director anymore because he's a pain in the ass. Okay, so then when you cut this, so when I went to the doctors and he thought maybe liver, and I'm thinking, yeah, the only organ that I kind of mistreat with some alcohol is the liver. And about a year ago, I thought I had some pains there, and I guess it was from that general area. And I had him do an ultrasound, and it was a little bit of fat in the liver, but nothing big yet. So I thought it was the liver when all these things came up. I'm thinking, oh, here we go. So he did all tests now. One good thing is I don't have HIV. We thought maybe hepatitis, which is something we can deal with. So I don't have HIV, I don't have hepatitis, I don't have any of that. So guess I could go ahead and have unprotected sex now that I'm dying. But so none of that, except for this, the pancreas, deep inside, So you can touch my blood because the blood is clean of HIV and all that. But yeah, that's all there is. I'm stage 4, which is, that's it. There is no treatment, and there is no, there's no getting out of it. And stage 4 is usually under 3 months. Stage 4 anything, unless I find a way to cheat this. But I'm not gonna be doing any chemo, because even if that extends it for like 3 months, I'm not like about to spend 3 months. Not that I care, I don't have a lot of hair left about losing the hair, but I'm not gonna spend an extra 3 months just to extend my misery by being sick every day over chemo. So I'm not doing that. I may see if they have some kind of trial thing, because since the trials, they could use that on the person after me if that works. If not, I'm going to try some alternative medicine. Funny that my daughter asked the doctor, what do you think of alternative medicine? And he didn't hesitate to say, that doesn't work. Well, fuck. Western medicine, obviously, with all the tests and all the shit they've done to me, doesn't work either, because you only detected it at stage 4. So, fuck Western medicine. So I've studied a lot. Before anyone that had cancer around me, I was reading. I never smoked pot. I never done drugs, which I want to start now because some of the drugs they're giving me are pretty good. I did read about hemp oil. Back in the 70s, they had actual scientific tests in favor of it for curing cancer. And I'm going to look into that. Because what's the worst that can happen? I die. But I'm definitely not going with the Western medicine that just kills you even more. So, emotionally, yeah, I don't think I'm... I find good jokes about it. The doctor, when he came to tell me, the first doctor that told me yesterday at the ER, I'd like to mention Danielle at the ER. You were lovely, a nurse. She was very sweet. She took care of me. And so the first doctor that came, they don't even want to use the word cancer. He says, well, the CAT scan that I had the day before, the results weren't in the day before, but when I told them I had it, they obviously knew that this thing had been going on since Monday. I had an ultrasound, and then Thursday I had a CAT scan, so they know something's up. So they looked it up, and he comes back and using every word there is around, telling me how they found that indications, and finally I had to say the word cancer. So he goes, yes, come on, just fucking tell me it's cancer, so I know if I'm dying. So they won't even bother. They don't even want to tell you. I want you to tell me, look, it's cancer. Either you're dead, you're dying, or we're going to fight it. And so, yeah, nobody wanted to. And this nurse, Danielle, then said goodbye to me, and her eyes watered. So, that told me. We had some conversations down there. She was very caring. Yeah. I mean, so the doctor walks in, and she's an oncologist. When you see an oncologist, it's like seeing an executioner. They don't send you a regular doctor. You see an oncologist, you're fucked. So, they don't want to tell you. Nobody has an expiration date, but hey, all I want is a roundabout. When someone at my stage, what is it? 2, 3, 6. I know you can't give me an exact date, but tell me that I have more than a week, because otherwise I'm wasting 72 hours in the hospital sitting here waiting for who the fuck knows what, just so that the insurance could get billed when I could be doing things. I am buying a brand new Porsche 911 Carrera. I'm financing it. all in my name. The one thing that bothers me the most is not the dying, because, like I said, I could die of any other risky things that I do. But not that I take care of myself. Well, I do take care of myself. I don't eat vegetables or any of that crap. I never needed to. Obviously, everything else was fine. But I do take care of myself as far as going to the doctors, getting screenings, getting more screenings than are allowed, because you go to a doctor and all they do is take a little blood and do minimum panels and listen to your heart and this and that. This particular doctor, he does what I like more, and then he accepts when I ask for even more. He's great with all that. So I go through those extremes that the average person doesn't do. Blood panels, so many things that insurance wouldn't even cover. That they were asking, why are we paying for this? And he would say, well, I found something, and he will help me out with that as far as telling them, because I would ask him. So I go that far in my life as far as getting screenings, as far as whenever I feel anything, I go to the doctors. I know what to say in order to them to send me to certain screenings, which normally they wouldn't. I've done that my whole life. I go through all this. I have a whole collection like this of CDs of every CAT scan, X-ray. You can get that, by the way, when you go to have those things. Sometimes they charge you $10. I've never been charged. You gotta ask them, do I need to pay? And they just throw it in. But yes, you could get all that. So I have a collection of my entire body scanned. And I go through all this, and no one could detect this. Now in Japan, which is the best healthcare as far as I'm concerned, and I looked into a lot of them system in the world. This is how they prevent. This is how people last. They have the longest, the living population in the world. They take care of them because what they do is, if you need 2 full body scans a year, they do it. So they'll detect things early on, and then they work on it. Here, like the doctor was saying, for example, pancreas, they in no way whatsoever ever check for it until you start showing symptoms, at which point you're already stage 4. Like some of the symptoms I had, they manifested as something else. Had I gone to the doctor, he may have taken a guess. But to be honest, good doctors are hard to find. I believe, having been a medic in the industry, I could tell quack doctors and quack nurses. And there's a good 90 to 92% of doctors who are quacks. Believe me when I tell you this, they're quacks. They have a degree, and they're just business people in this industry. The other 8% are good, and they care, and they look into people, and they look to cure. This happens to be one of those guys, because it took me a while to find them. I shop around, even dentists. It's taken me a long time to find my good dentists, because I've been to quacks. But this guy was very thorough, and I was very thorough about asking for things, and yet we never detected it. So can you imagine people who, one, I don't like to go to the doctor because if they find, well, by the time they do, you're dead. People who don't have the insurance, or people who don't know what to ask a doctor, or people who, like my father used to believe, well, doctors know best. No, doctors don't know best. Okay, a C-average doctor, when he graduates from medical school, still called doctor. Okay, and a lot of them are quacks. And so people trust doctors. Don't trust them just because they have, same thing as a lawyer, just because they have a diploma. A lot of them are useless. They're just people who stuck around long enough in school to get a diploma. That doesn't make them any good. So this guy is good. Getting back to Japan system, They have a lot of preventative medicine where they do a lot of screenings, and that's included. Now here they don't do it because it's considered expensive, which is really not as expensive if you use them more. The reason that it's expensive is you have a CAT machine, you use it say 12 times a day, so now you get to charge $1,500, $1,800 per scan. If you were using it 60 times a day, you could start charging $300, $400, and insurances would pick it up. But here is all about it's big money instead of volume. If we scanned everyone, we could prevent this kind of thing. Like it could have happened with me.
Do you feel that the system let you down in terms of not properly or thoroughly testing you?
I'm not going to blame the system. I'm not going to go and blame the system because of all people, like I said, I'm the type of person that has the medical knowledge, grew up in a family of doctors, pharmacists, nurses, everything. And I know enough to have asked for tests. And I know enough to recognize certain signs and symptoms, even though this one was very vague. So could I have, whenever I had a little pain here and there, gone and asked and made a doctor give me a screening? Yes. But I did what everybody else does. Oh, it'll go away. And it did. Things did go away. So is it the system's fault? In my case, probably not, because I could have known better. But is it the system's fault when it happens to other people who are not knowledgeable or educated? Yeah, because people, again, don't like to go to the doctors. It's excruciating to go to. I have a private doctor and he's good, but when you have to go to one of those clinics, you don't want to go in there. I never try to go to the ER. I came to the ER now because I know my wife worked at the hospital, and because I know the doctor attends this hospital, and I know it's a good hospital. Otherwise, I wouldn't go to an ER. I wouldn't have gone to and keep this name in there. That shit should be burned down to the ground. You never go in there. You don't go to places like that. If you have to go, you go to, here in New Jersey, you could go to Hoboken. University is pretty good. Hackensack. But again, who wants to go into an ER? The average person doesn't, and so things get missed because it's like buying a used car. Nobody wants to go into a dealership. Nobody wants to go into an ER. And then the system is not designed to allow, even if a doctor wanted, to do a routine screening because it's very expensive as far as the insurance is concerned. So with regards to me, I don't blame the system. I blame myself a little. Although if they had a system like in Japan, I would have had a full scan and this would have been detected 4 or 5 years ago. But with regards to other people, yes, I would blame the system. The system is very flawed. And even with this whole Obamacare and all that, this is just an illusion. No one's getting any more care than they were before. No one's more covered than they were before.